Good morning, dears. Today we are going to deal with the pathology or pathogenesis of chronic pancreatitis. Being a very chronic, slow, progressive change that happened in our pancreas, all these inflammatory changes results in fibrosis of the gland. That means here the pancreatic cells are replaced with fibrosis. It is somewhat the same pathology that happened in cirrhosis of the liver also. As you know, in cirrhosis, the hepatocytes are replaced primarily by fat cells, and due to the chronic hepatic insult, there is stimulation of Kupffer cells, those cells which are seen in between the hepatocytes, which stimulates the collagen formation and thereby fibroblastic proliferation with the deposition of glycoproteins or proteoglycates and collagens, etc. Finally, the liver will convert it into a very hard, dense organ. Like that, in our pancreas also, due to heavy insult of the pancreas by either by alcohol or by heavy drugs or by autoimmunity or immune complex formations. In such condition, there will be edema, ischemia, necrosis, calcifications, fibrosis, etc. can be seen. All these changes will result in exocrinal and endocrinal insufficiency of the pancreas. Being a chronic inflammation or a low-grade inflammation, it will take a long time to produce symptoms. If there is exocrinal damage or exocrinal cellular damage occurs, the enzymes which secreted by the exocrinal tissues, namely amylase, trypsin, protease, lipase, etc. are very, very essential for the digestion of mainly amylase for starch or carbohydrate, lipase for the digestion of fat, and protease and polypeptides are very essential for the degradation of proteins and amino acids. So, the damage of the exocrinal cells in the pancreas that will result in maldigestion, malabsorption, maltransportation and malnutrition. All these pathologies can be summarized with the heading of malabsorptive syndrome. Due to the malabsorption, the patient will develop malnutrition. And regarding the endocrinal insufficiency, usually or surely our patient will develop symptom of diabetes. Unfortunately, as you know, the symptom of diabetes will develop to take near about 10 to 20 years. Like that, the exocrine or the malabsorption or malnutritive symptoms are also very non-specific or subtle symptoms. So, the symptom of a patient of chronic pancreatitis are different in each one. That means the symptoms or the intensity of the symptoms depends on the degree of or the extent of or the class of damage. And we can study the clinical presentation of a patient with a chronic pancreatitis in next class. Thank you for watching. Thank you.